Separated from his parents, an infected 4-year-old highlights the human cost of China's zero-COVID policy. CNN covered from head to toe in a white hazmat suit. A small child carrying a backpack half the size of his body toddles down a hospital corridor and arrives at CT scan room all by himself. A 4-year-old boy has been infected with COVID-19. Unfortunately, a caption in the video reads, "No accompanying parent going to quarantine alone." The scene, captured by the nurse at a quarantine hospital in the city of Putian, this epicenter of China's latest Delta variant outbreak, gripped millions of people when it went viral on Chinese social media this week. "It makes my heart ache," said one of the top comments on Weibo, China's Twitter-like platform. "My eyes are getting teary," said another. The video serves as the poignant reminder of the human cost of China's surprised zero-COVID policy, which has helped the country queer multiple resurgences of the virus. The elimination playbook consists of placing entire neighborhoods under lockdown, testing millions of residents in the matter of days, and swiftly isolating infected people and their close contact in designated facilities. This time, the strict measures were applied to school children, among whom the outbreak was first detected and spread quickly. In Putian, 57 of each recently reported 129 cases are under the age of 12, according to the government. To prevent further transmission, infected children as young as kindergarten age are separated from their parents and put in hospital isolation. In a news conference Thursday, the Putian government said China's epidemic control rules bar COVID patients from any company during isolation and treatment. But if a child and their parents are both infected, the hospital would try to arrange them to stay in the same ward, an official said. Initially, some children who came into contact with the infected but tested negative were also quarantined away from their parents. That policy was later relaxed, with children under 14 allowed to stay with their parents or other family members in quarantine. But isolation for infected children remains. Zhu Xiaoping, the nurse who took the video at the quarantine hospital, told the local Fujian Health Daily newspaper her eyes were wet with tears when she saw an ambulance full of children arriving, or sealed up in hazmat suit. They had arrived late because the children didn't want to leave home and was crying for 2 hours before being coaxed into the ambulance, she said. Upon arrival, the children had CT scanned by themselves. Some were so young they couldn't, climbing onto the scanning table and had to picked up by a doctor, Zhu said. Seeing little children all alone by themselves without parents by their sides in the hospital they were unfamiliar and scared of. At any moment my heart will act, she said. On Weibo, some users questioned why children this young couldn't be accompanied by their parents. Others pointed out their parents are likely put in centralized quarantine in their facilities as close contact of the infected. It's basically a strategy of rather killing a thousands by mistake than letting one go, said Jin Dong-yan, a virologist at the University of Hong Kong. Children shouldn't have needed to undergo such extreme quarantine measures. This is the social cost of the zero tolerance approach. Government workers stopped a biker at the entrance to the residential block under lockdown in Xiamen in southeast China's Fujian province on September 14. The strict and often hectic implementation of containment measures has sparked discontent before. In June, hundreds of residents in Foshan, Guangdong province protested against weeks of prolonged lockdowns on their neighborhoods. Footage of the rally was shiftily scrubbed from the internet, while the social media, those who criticized or questioned the zero-COVID policy were attacked and muffled by online nationalists. The zero-COVID strategy still enjoys the broad support among the wider Chinese public, many of whom have grown accustomed to the benefits associated with the COVID-free living and remain fearful of the virus, partly due to the unrelenting state media coverage on the devastation the pandemic has caused abroad. The success of the stringent approach is partly built on public fear. This is not ideal, Jin said. The correct way is to tell the public the truth about the need to coexist with the virus, which is the only sustainable way going forward. Across the world, a growing list of countries have opened up after massive vaccinations. Others, such as Singapore and Australia, are also shifting away from the zero COVID strategy to a new approach of learning to live with the virus. But the Chinese government has remained reluctant to lift the border restrictions despite the huge achievement in its vaccination drive. On Thursday, China had said it had fully inoculated 1 billion people with domestically made vaccines, accounting for 71% of its population of 1.4 billion. The vaccination rate is higher than that of many countries which have opened their borders, including the United Kingdom's 64.8% and the United States 53.4%. Xin, the expert at the University of Hong Kong, said authorities are worried about the efficacy of the vaccines. Chinese officials have revealed that some of the early cases in the previous Delta outbreak were fully vaccinated. They are concerned that the social immunity is not strong enough. They don't have enough confidence in the vaccines, he said. China is now offering booster shots to fully vaccinated people working at borders, customs, quarantine facilities, COVID hospitals, and the aviation industry, according to the National Health Commission. But it remains to be seen how long the effect of that extra shot will last. For the time being, the Chinese government is likely to stick to its zero-tolerance approach as it attempts to boost public immunity. But it will eventually need to learn to live with COVID, Jin said. It might go on for another year or two, but China can't shut its doors forever, he said. At the quarantine hospital in Fujian, medical workers have come up with various ways to comfort the infected children. They decorated the isolation walls and the corridors with cartoon paintings and provided the kids with children's books, toys, and stationery. Nurses also looked after their daily needs and played games with them, according to state media. But some worry that's not enough. During the day, it might be okay, but at night, the kids will still be scared, said the comment on Weibo.